Good morning, everybody. Happy Tuesday, happy heat wave. Oh, it's so hot here. It's hot everywhere. Y'all need to be really careful if you're outdoors or if your spouses, parents, kids, somebody is doing anything outdoors. Stay well hydrated and well salted. Good morning. I'm Jenny Gallagher with Joyful Heart Healthcare and Keto Nurses. We're going to talk a little bit about boron and bones today, basically about osteoporosis and bone health. So hit that share button so that other people can find out about bone health. You can share once we're done if you don't want them on live with you while you're here with me. But make sure you're sharing things so that the word gets out. Good morning, Kimberly. Good morning, Suzanne. Good morning, Debbie. I see the numbers popping up here. So very good. Glad to see y'all this morning. Seriously though, y'all, this heat wave is no joking matter. Make sure y'all stay hydrated, and if you have to be outside, get extra salt, get extra electrolytes, get extra water. My mama used to say, don't drink ice water when it's hot, drink room temp water, because the temperature changes can make your belly upset. I don't know how true that is, but that's what my mama used to say. Morning, Mary. Good morning, Suzanne. Glad y'all are here. Numbers are going up. Yay. So, we're going to talk about a supplement, an essential mineral that many of you may not have ever heard of before, but we're going to talk about some data, and once I get done, I have several links to the articles I'm using for reference material, and I'll post them in comments so that you can look at them and realize that I'm not making stuff up just off the top of my head. It's real research, okay? So you'll be able to see that. Good morning, Diane. I'm almost done with my coffee, so I got my water handy. So grab your coffee, sit back and relax, and let's have a chat. So, boron. What is boron? It is an essential micronutrient that does a whole bunch of things within the body. Most people, most providers, doctors, researchers, most people that know about boron really only associate it with bone health. But there are, in this article, there are 11 different benefits to boron and its function. Number one, of course, essential for the growth and maintenance of bone. So it's vital. That's what essential means. It means that your body can't produce boron from other chemicals you intake. If you look at a chemical table of elements, you'll see that boron is the smallest available molecule of boron. Like, you can't break it down. Like salt is sodium chloride. You have two different elements that combine to make the molecule of salt. Boron is boron. It doesn't get any smaller. So it's essential. It is determined essential. That means we absolutely must consume it. It doesn't come from anywhere else if we don't eat it. Okay. So number two, it improves bone surgery, healing. If you have a wound, a surgical scar, a surgical incision, you've been in an accident and you have lots of injuries, wound healing is significantly improved by supplementing with boron. So that is a great way to improve bone surgical healing. I know lots of patients that I have walked through surgery with as a provider or as a friend, and sometimes I do recommend vitamin C and zinc and L-carnitine for healing, CoQ10 for healing, but it didn't dawn on me to recommend boron. So if you are not taking OsteoPX, which is the vitamin D supplement I typically put my patients on, it includes boron. You might want to consider asking your prescriber about using boron. Just be aware they're probably not going to know anything about it. But you might trigger them to do some research. Number 3, boron significantly improves the body's use of estrogen, testosterone, and vitamin D. Okay, so if you have hormonal imbalances, if you have insulin resistance driving your estrogen dominance or your low T, those problems can be significantly improved with the addition of boron either in your diet or in your supplement. So that's something to think about. Boron is a cofactor for magnesium. Y'all hear me say all the time that the quarterback cannot do the work of the football team on the field by himself, okay, by herself. So the quarterback is only one member of the team. Boron is only one member of the team. Vitamin D is only one member of the team. Magnesium is only one member of the team. So if you look at your vitamins and supplements like a team, then it makes really good sense that you consume them in the presence of each other and the food that we consume. Some of those foods some of those supplements, A, E, D, and K specifically, are fat soluble without fat coming in at the same exact moment as those fat soluble vitamins. Your body can't use them. You're wasting a lot of money, a lot of time, a lot of effort to go take those vitamins on an empty stomach. Literally, in between bites is the only way to make sure your supplements are absorbed in an optimal fashion. You may get a little benefit, but they won't be optimally absorbed. And if you're going to spend $50 on a bottle of something, in my world, I'd want it all as effective as possible. That's just me. So think about that. But boron boosts magnesium absorption. So boron is a cofactor for magnesium absorption. If you're struggling with muscle aches, back pain, joint pain, fibromyalgia, a lot of times magnesium will significantly improve that muscle ache, joint pain. But in the presence of boron, magnesium may work even better for you. So that's something to think about. Number 5, boron reduces inflammation markers. How many of y'all have high CRPs, high uric acid, high ferritin, high homocysteine, high white blood cell counts? Or I told you these markers are indicating you have a lot of inflammation, or even a little inflammation. If you have significant inflammation enough to trigger it being counted and seen in lab results, that's a lot of inflammation. So boron is a great anti-inflammatory agent as well. Number 6, boron raises antioxidant enzymes. Several enzymes, most of you are familiar with glutathione as one of those enzymes, but there are several impacted by boron. But glutathione is a great aid for healing, for gut health. A lot of people with IBS or Crohn's disease significantly improve gut health by using glutathione. But glutathione, catalase, several other enzymes are improved when boron is present. So that can be really beneficial. Remember, enzymes are chemicals that influence a process. So for instance, amylase is an enzyme that breaks down sugar. It's secreted in your mouth, in your cheeks, in your saliva. There's a lot of amylase. Amylase starts to break down carbohydrates we consume into sugars. So even when you're chewing and swallowing food, your bloodstream is getting glucose directly from your cheeks because of that amylase. Your amylase is breaking down that carbohydrate very rapidly into glucose. So glucose goes straight in the bloodstream from your mouth. As you digest food, as you swallow food, you begin digestion. There are other enzymes, pancreatase, lipase, proteases, like lots of other enzymes. Those also break down other chemicals like they do the carbohydrate into sugar. So lots of chemical processes have to occur. And if you want to optimize those enzymes, then adding boron to a supplement plan or using OsteoPX might be something you want to consider and talk over with your prescriber. Number 7, boron protects against pesticide-induced oxidative stress and heavy metal toxicity. So if you think you have pesticide exposure, if you've lived on a farm or worked in the farming industry, gardened with your parents or grandparents over the years when we've used lots of pesticides in our yards and gardens, if you think you have heavy metal toxicity, if you think you have mercury toxicity from amalgams and fillings in your teeth, boron can help detox some of that. So if you have read about or heard about somebody talking about good detoxes or whatever for your body, boron might be something to consider along those lines, because it does help with heavy metal toxicity and those oxidative stress molecules that get in the body. Number 8, boron improves brain electrical activity. So for those of you who report brain fog or forgetfulness, or, oh my gosh, I feel like I'm, just aging so fast because I can't keep up with all of the things. Like the kids have to get here and I have to go there and I was supposed to do something else, but I don't remember. All of those kinds of things might be improved with a little boron use or increased boron in your diet. If you have elders in your family who are struggling with some of that cognitive decline, sometimes it's a boron issue. Sometimes it's an estrogen issue. Estrogen deficiency is one of the most common causes of dementia, especially in women. So think about that when you start talking with family members that have cognitive issues. So there are lots of contributing factors. Insulin resistance is by far the most common contributing factor for Alzheimer's, but there are other types of dementia, and many of them are related to estrogen and or boron, vitamin D deficits, protein deficits, those kinds of things. So think about all of those things. Let me find my list. Number 9, boron influences the formation and activity of molecules like SAMe. SAMe is vital for hormone management, various protein utilization, and NAD, a nicotinamide adenine dinucleotide, which is sort of like the new kid on the block for supplements. It's very common in IV hydration mixes. If you want an IV, NAD is one of the things heavily marketed by hydration med spas, and other practices that do IV hydration. Because NAD is really important for a lot of chemical reactions and processes within the body. So boron can improve that balance with SAMe function and NAD function. Number 10, boron has demonstrated prevention and therapy effects with relationship to some cancers. So if you are wanting to prevent cancer, or if you've been diagnosed with cancer, you may want to ask your prescribers, your oncology team, about the data on boron and see if that might be a possible part of your treatment plan. Some of the specific cancers in the studies include prostate cancer, cervical cancer, lung cancer. Some of the non-Hodgkin's lymphomas are benefited and slowed or reversed by the use of boron. We've known for a long time, and COVID, the pandemic sort of made it more prevalent in awareness, that vitamin D in really high amounts in the bloodstream on the upper end of the range was very good for immunity and for cancer prevention. So now we're seeing other things come out with relationship to boron. So if you have patients or friends or family members that have prostate, cervical, lung cancers, multiple myeloma, and non-Hodgkin's lymphoma. Say that 3 times real fast. All tongue-tied this morning. So that was number 10. Number 11 is that boron may help reduce the effects of traditional chemo. So even if it's not helping the cancer itself, boron might reduce some of those nausea, vomiting, hair loss, fatigue symptoms that come with the chemotherapy we use to treat our cancers. So think about those things. How much? Well, none of the studies used more than 3 milligrams a day. And I think that's the amount that's in the OsteoPX that I typically recommend for my patients. So about 3 milligrams of boron is really all that's been studied. And it's one of the things that I don't know that you'd see any better benefit with that more is better kind of philosophy. Remember, more is better often causes side effects and problems. With bone chemistry, with hormone chemistry, you really don't want to rock the boat significantly. You want to calm the boat's rock is what you want to do. So if your boat is in the water with all of these hormone imbalances, all of this osteopenia, osteoporosis, and your health is teetering on health or illness, then taking a lot of boron might not calm that rock down. You follow? So we want just enough to calm things down, which would be about 3 milligrams a day or less. It does come in a variety of supplements, a variety of doses. I think in the OsteoPX that I typically recommend to my patients, it's a 3 milligram dose. So with all of that said, those are the benefits for using boron as a supplement. There's the one caution, there's no specific indication. So when we talk about supplements, supplements are different than medications. So when we talk about medicines get indications. So if you look up, for instance, lisinopril, it's a blood pressure medicine. Lots of people take it. But if you look up lisinopril on a drug site like drugs.com or hippocrates.com or rxlist.com, you may see it's FDA indicated for hypertension, kidney prophylaxis, kidney damage prevention. So it's indicated. That means the FDA has specified prescribers can write this prescription for these specific reasons. That's what an indication is. When we use supplements, though, they don't get that same label by the FDA. They're approved by the FDA if they are shown to be safe. That's about it. But they don't get an FDA indication like you take boron for bone health, you take boron for cancer prevention, you take boron for any of those 11 reasons we just talked about. Those are just findings in studies. So in studies, we've seen those benefits, but the FDA does not indicate boron for a specific use. In fact, most of the vitamins and supplements have no indication like that. That's just not how supplements are labeled and classified. Okay. So when you choose to use a supplement, know why you're using it, know exactly what its benefit is going to do for you, and know what possible side effects you could have from it. Most supplements don't come with many side effects, but like your B vitamins, they're what we put in energy drinks. So when you take a B vitamin or drink an energy drink, what is the expected result? Anybody want to guess? What if you take a B vitamin or drink an energy drink of some sort? Why did you take that vitamin? Why did you drink that drink? Come on, people. For more energy. So if you are bouncing off the walls, you got energy. So that's not necessarily a side effect, but it might be an unwanted effect. If it makes you nervous and jittery and can't sleep and you're just like nonstop, that's not a great feeling unless you have thousands of things to do, like some of us do. But that's exactly right. So you might feel that excess amount of energy, especially if you don't have a way to expend it. If you're busy and running here and yon, getting kids to and from school and activities after school and work has got you busy and stressed and doing all these kinds of things, the B vitamins may be very beneficial for you to boost your energy level and to help you get through all of those activities, all of that added stress. But if you are more sedentary, like me, sitting in front of a computer all day talking to patients, I don't necessarily need that energy rush. So a lot of days I skip my B vitamins because of that. I take it on days when I don't have much red meat. If I have a chicken meal or a fish meal, I might use my Bs those days, especially if I have lots to do. Lots to do are usually my Fridays and Saturdays and Sundays, not my Monday through Thursdays when I sit in front of the screen all day. So a lot of times people will use those vitamins for specific purposes, but they come with unwanted effects, not necessarily side effects. So that's different than a medication as well. But you want to make sure if you are taking a supplement, what good is it going to do? What might it do that I don't want it to do? Okay. So think about that. Other studies with regard to boron have indicated that the bones, this is why we're talking about boron today, related to osteopenia and osteoporosis. But the studies show that the bones of the axis, that's your torso bones, your spine, your pelvis, the bones of your torso, and the bones of your appendage, your arms, your legs, might respond differently. I think that's probably related to the weight bearing, because your torso bones, your spinal bones, your pelvis bones, these all are weight bearing bones. And so they bear more weight, requiring more energy, function, and utilization. So that may be why we see some differences in boron's effectiveness at changing axial bones versus appendicular bones, those of your appendages, your arms and legs. So think about that. Mechanical properties of bones are what they evaluate. So what are those? Well, that's how your body moves, the function of your body. If you wanted to do a mechanical assessment of your car, what are some things you would check? How it cranks, is the battery operational, is the starter working? You check the oil, check the gas. Those are mechanical markers of your car's health. We have mechanical markers of bone health that are identified on images, x-rays, MRIs, various DEXA scan kinds of machines. So sometimes the evidence is mixed, and that's what I'm going to talk about next. First, I'm going to go ahead and define osteopenia and osteoporosis. So there is a difference. Osteopenia means that your bones are becoming weaker. So when we look at the DEXA scan, the scores, the T-score, from 0 to -2, -2.5, depending on which author you read, is considered osteopenia. If your T-score is -2.5 or greater, meaning 2.5, -3, -4, -4.2, the lower your negative score, the lower it falls, the worse the bone strength. And so if you're in that one-ish range, the negative one-ish range, you have osteopenia. That means you are building less effective structure in your bones. What does that mean? Well, cells are constantly dying and being replaced. If your bone cells that are dying from old age, they only live so long. They're not permanent fixtures. Cells live and die. So as bone cells die off, they're supposed to be building new to replace it. But if you don't have the right ingredients to build that bone back, your body can't do that. And that's when we develop spongy bones. Imagine a sponge. Take 2 sponges and try this experiment. If I'd have thought about this ahead of time, I would have had 2 sponges for y'all to see. Let one sponge dry out or buy it brand new, all dried out. If you stand it on end, it'll just about stand up straight because it's strong, it's stiff, it's sturdy. The holes in the dried up sponge are much smaller. Wet a sponge and stand it up next to it. put a little bit of pressure on both sponges at the same time. Take your fingers and mash down on the hard, dried out sponge with the holes close together, and mash the other finger down on the wet, soft, mushy sponge. Which one collapses easier? That's what your bones are doing if you are developing osteopenia, osteoporosis. Okay? So that is the best analogy I have for you. If you want to see that in person, get 2 sponges and try it. I would love to see pictures or a short video clip if you do it. But the stronger your bones, the better the turnover. If you are losing bone, you are replacing bone at the same time. Okay? It's a steady dying off and replacement all day, every day, all week, all month, all year. As we age, however, why does osteopenia or osteoporosis happen more in our aging population? Because we don't often have enough of the ingredients. A lot of times we don't eat as well, especially if we are widowed. A lot of times single household personnel just don't cook very much. We don't cook a lot of food because it's just me. I can snack on this or that and I don't have to worry about a big meal. Well, if we take that philosophy, then we're missing ingredients specific to bone replacement. If we aren't taking specific supplements, we aren't getting adequate ingredients for our bone health, and our bones will weaken. What are some vitamins and supplements we've already mentioned some, help with bone health other than boron? What do you know helps with bone health? If you wanted to improve your bone health, what would you take? If you wanted to improve your bone health, what would you take? Diane says vitamin D. Good choice. Suzanne says magnesium. Good choice. Mary says D3, K2, and magnesium. Good choices, ladies. Good job. Yes, those are essential to bone health. But one that y'all didn't mention, is protein. Remember that proteins are the building blocks of the cell. If your protein intake is not in optimal range, then you do not make good cells. Okay? So protein is just as important as getting your vitamin D, your K2, and your mag. Protein needs a cofactor of vitamin A. Remember our butter video before. So think about all of those things. That's why I tell people to take all of your vitamins with your food. Your body knows what to get from what. Okay? Your body's pretty smart. Let's see. Suzanne says vitamin K2. Tara says calcium. Calcium is a no-no, Tara. That's mainstream medicine's recommendation, but the outcome studies with calcium are not good. They show improved bone density, but no improved fracture rates. And that's the problem with bone density. If you're having bones that are breaking, we want that to stop. And with calcium supplementation, there's not much data that suggests calcium stops the fractures. It does improve density a little bit, but it's not stopping the fracture rates. And that's our real goal, is we want to slow down the fracture rates. Okay. Tina says, I've heard K2 with D. Yes. So on my website, joyfulhearthousecalls.com, there is an article about vitamin D, and it goes into great detail about all of this information except boron. I didn't know about boron when I wrote the vitamin D article, so now I need to go back and edit it and update it. But boron is another cofactor for D absorption, magnesium absorption, bone growth, and strength. So with all of that said, let's look at some data. So there are 2 really big studies that have been done in recent years. One was called the FLEX trial. And the FLEX trial was covering about, let's see. It doesn't say how long it went. 6 to 10 years. So they watched people over a 6 to 10 year period of time. Okay. So what they studied was, does Reclast, that's one of the drugs that we mainstream uses for bone strength. Does that drug really strengthen bone health? And so what they showed is that the bone mineral density, the scores, improved slightly with the FLEX trial. So that's where mainstream medicine gets their foundation for using these medications. Yes, we showed in these trials over a 6-year period, we got stronger bones. But then along comes the Horizon trial, and it does not show the same thing. So then we have a conflict of interest. So how do we decide who to believe? Most of the time, we decide who to believe based on who tells us about which one. So what I encourage people to do is do their own research. Read these links, go look at these studies, and then you decide what you want to do to fix your own health. Remember that mainstream medicine, I didn't have, no nurses have, no doctors have, no PAs have any significant nutritional training. The nutritional training we get happens because we have to fix ourselves or we do some research into nutrition after we're practicing. There is usually a 1 to 3 hour course in the prereqs, like at your junior college level, community college level, first 2 years of college when you're 18 and 20, that teach you about nutrition. And really all they teach us is what the vitamins are, what they do, and then there's nothing. So if you don't really dig into nutrition and A&P, anatomy and physiology, and discover for yourself how nutrition impacts health, you will never know how important nutrition is to your health. And neither will the prescribers that we go see. But nutrition is not part of our professional training. It's not included in medical school. It's not included in nursing school. It's not included in physical therapy or occupational or osteopathy school. It's not part of any professional training program once we're in those programs. It's a prerequisite. And a lot of times it's an elective. So if there's another option, you might choose something else. So there might not be any nutrition training in your educational background. So keep all of that in mind when you go and talk to your prescribers about nutritional components. Offer them links, offer them data. The PubMed website is a great place to pull professional articles. You don't want to pull them from my blog unless they have data supporting it. You don't want to pull them from the news links. You don't want to pull them from just anywhere on the web. You want to look for PubMed published articles, NIH published articles, articles published in peer-reviewed journals are your best bet. And so that can provide you with some sort of ammunition to discuss this conversation with your prescribers, okay? So with regard to the FLEX and Horizon, we have conflicting results. So is the medication beneficial to bone? One study says yes, one study says maybe not. So therefore, we have to wonder if our bone health is truly improving. And that brings us to testing intervals. How often do you get your DEXA scans? Well, the United States Preventive Task Force Service says at age 65, all women should be tested for bone density. It's called a DEXA scan or a bone mineral density test, a BMD test. And you can ask for that at your annual wellness visit or anytime you like. In general, Medicare will only cover that once every year or 2, sometimes 5 years, because there is no interval testing recommendation. Okay, so if you are told you have bone mineral density problems, osteopenia or osteoporosis, and you are tested, let's say August 2023, right now, and you're told you have this diagnosis and you work on it for a year or 2, how do you know when to go back and retest? You don't, because there is no set recommendation by any authority or organization. So this is one of the cases where you as a healthcare consumer have to take your own health into account. You have to be the boss. You have to be the advocate. You have to monitor what's going on with your health. And that might include asking for a follow-up DEXA scan. Usually I recommend them every 2 years. Bone density is going to take a long time. You're not going to see a huge improvement from 1 year to the next. But in 2 years, if you are increasing protein, increasing your vitamin A intake, increasing your D, mag, boron, if you are doing these specific things to strengthen your bones, then the bones do get stronger. I have 3 patients so far that have been using this method for a couple years, and they are reducing, improving their T-scores. They've gone from -2-ish to -1-ish. And that's where you want it to go. Okay, I have a few comments and questions, so let's see what we see here. Mary says, I have osteoporosis in my spine, and yep, lots of people do. Diane, mainstream pushes calcium constantly. Yes, they do. But if you look up calcium supplementation and cardiovascular disease, you will see significant links. You can Google that. Just type in calcium supplementation, cardiovascular disease, and you will see now that cardiovascular disease, hardening of the arteries, is a definite correlation to high calcium intake. We even know that in mainstream medicine because we now do a test called a coronary artery calcium scan. So that test is scanning for that calcium supplementation that's landed in the arteries and caused your arteries to be stiff and not pliable, not flexible the way arteries are meant to be. So even mainstream medicine sees it, they just don't make the connection. The dots are not connected all the way. Suzanne says, I take magnesium threonate at bedtime. So you can take magnesium whenever you choose, but if you aren't taking it with your D won't be absorbed well. So a lot of people use threonate at bedtime because it is great at reducing anxiety. Some people will use one kind of mag at night and another kind in the daytime with their D. So that's another possible solution too. Debbie says, I need to look at who funded those trials. Oh, well, you know who funded those trials, Big Pharma. So that's all the comments I see right now. Any other questions y'all have about bone health, osteopenia, osteoporosis, boron, magnesium, vitamin D, protein? Remember that protein is best derived from meat, eggs, cheese, animal-based products. Never, never, never from your plant-based products. Plant-based products have very, very, very poor accessible protein to the body. If you consume 10 grams of plant protein, only about 3 grams are usable by the body. And that's only if it's a complete protein. Remember, plants are incomplete proteins. We have a whole video from a few weeks back about protein, maybe several months now. So if you are interested in protein data, go look at the protein video. There's a great video on protein. Mary, is there any reason at all to take a calcium supplement ever? There are very, very, very rare circumstances when I do recommend calcium, but it's in a very low dose and it's for very specific reasons. In general, there is no generic, you should take calcium recommendation. Okay? Good question. So, Mary, how do you combat osteoporosis when it's called? Because inflammation drives poor health in general. Get rid of the grains and you get rid of the inflammation. Hashimoto's will almost always reverse itself, as does the Epstein-Barr flare. Synthroid is not a contributor to poor bone health, as mainstream medicine would have you believe. In fact, poor thyroid management will make your bones worse. Thyroid health is vital to good bone health. So you want to make sure that your bones are taken care of and that your thyroid is taken care of properly. But Synthroid is a terrible drug for the majority of patients with hypothyroidism. Tina says, is there any correlation between chronic kidney disease and bone status? Not, well, maybe. It's not a huge correlation. There's a better correlation between hypothyroidism and chronic kidney disease. And then you have bone issues because of that dominoing effect. Remember, the thyroid manages all of you. It controls all of your metabolism. And so if you have chronic kidney disease, you want to look at your triglyceride level. You want to look at your fasting insulin level. You want to look at your vitamin D level. You want to look at your magnesium levels. You want to look at your protein levels, as well as your thyroid and Hashimoto's markers. Mary now says, I had COVID earlier, and since then my thyroid symptoms are worse. Of course they are. COVID wreaks havoc on metabolism. It destroys thyroid function, even in the presence of medication. COVID destroys iron metabolism. It's a huge thing. You really need to have the lab panel that I post frequently about and get that done and look at it from a more functional perspective, not from mainstreams. Nina says, is armor bad for your bones? Nope, it's actually very good for your bones. Low TSH is pretty useless. TSH doesn't tell us anything about your health. Mainstream medicine would have you believe that a low TH is equivalent to hyperthyroidism, which it's not. So there are a few very small studies that have linked true physiological hyperthyroidism to poor bone health. And so by some weird connection, they draw this link to, oh my God, if you have hyperthyroidism, then you have terrible bone health risks. So therefore, if your TSH is low, you must have hyperthyroidism, so you have terrible bone health. That doesn't make any logical sense. So, yeah. But treating hypothyroidism appropriately is what I do. I treat the free T3 and the reverse T3 in an appropriate way so that we find the real problem, fix the real problem, and then we monitor that with labs. That's the only way to monitor thyroid problems. Yes, we do monitor symptoms, but we watch labs on purpose. Suzanne, how do we get an appointment with you? Go on my website or my Facebook page, and you'll find contact information. Our email address is joyfulheart4722, one heart. I have lots of people try to email Joyful Hearts with an S. The address is not plural, it's singular. So the address is joyfulheart4722@gmail.com. You can email that address and Kimberly will connect with you and get you scheduled. If you're in a state where I can see you or I have practice permission and license, you can also call our office number 402-804-4722. And Kimberly will, again, connect with you and get you scheduled for an appointment. But there's multiple ways to reach out to us if you missed that information. You can go back and catch the replay and fast forward to that information, or you can just go on my website or my Facebook page and find how to reach out to us. But both of those ways work quite well. All right, we went a little bit longer than I intended today, but I hope this has been really beneficial. And like I said, I'll get some of these links posted in the comments so you can see the data for yourself and look up the articles and go from there. Mary, licensed in Oklahoma. I don't think so, because Oklahoma continues to require a collaborative physician. I can't afford to pay a collaborative physician a couple $1,000s a month to see 2 or 3 patients in a state. It's just not feasible. I couldn't do that. So I will never apply for licensing in states that require collaborative physicians. Debbie says, off subject, but I wanted to share, I'm going to this weekend to a conference, Dr. Eric Westman. Oh, good. Those are some good people. Ken Berry, Nisha, Craig. Yes, very good. Enjoy. It's a great way to meet and learn. Okay. All right, guys. Y'all have a great day. Stay cool. Stay warm inside where it's cool. Stay hydrated. Stay salted. Remember, salt is the absolute most important electrolyte we consume. So we need way more of it than mainstream medicine suggests. So make sure you're getting your salt in. If you aren't using iodized salt, make sure your iodine is coming from somewhere. See y'all. I'm Jenny Gallagher with Joyful Heart Healthcare.